Hey everyone and welcome. This is Francesca from Social Work Portal. Have you ever wondered which anxiety or depression assessment you should use? Or when to choose a PHQ-9 instead of a PHQ-2? That's exactly what we're going over in this video. I'll take you through the most common mental health assessment tools used to assess anxiety and depression, and when to use each one. So let's get you leveled up on your assessment knowledge and case management process. One of the easiest ways to improve your mental health intake assessment is to begin with short screening questionnaires. The PHQ-2 for depression and GAD-2 for anxiety each take less than a minute to complete. You may have even seen one of these at your doctor's office. They work well in busy behavioral health practices, nonprofit organizations, and integrated healthcare settings. You can think of the PHQ-2 and GAD-2 as filters that help determine whether or not clients should complete a full depression or anxiety assessment. They're generally given to wide populations, and from there they can filter anyone who may need to go the next step. And so what is that next step? If someone has a high score on the PHQ-2 or GAD-2, they may go on to a full assessment, which would be the PHQ-9 for depression or GAD-7 for anxiety. These two assessments are considered two of the most trusted evidence-based mental health assessments available today. You can tell by the number after the letters how many questions are on the assessment. For example, PHQ-2 and GAD-2 have 2 questions each. Quick screener. PHQ-9 has 9 questions, and GAD-7 has 7 questions, allowing you to dive deeper into their mental health assessment. They give clinicians measurable scores that support treatment planning and documentation, while making it much easier to monitor client progress over time. Many organizations administer both assessments together because anxiety and depression frequently occur at the same time. Now, as your clinical experience grows, you're likely to use more than just the PHQ and GAD assessments. There are many different types of behavioral health assessments. They all have rating scales and all serve unique purposes. Let's take a quick look at some of the other mental health assessment tools you should know. The Beck Depression Inventory. This is a self-report questionnaire used to measure the severity of depression symptoms in adolescents and adults. The Beck Anxiety Inventory, a self-report assessment designed to evaluate the severity of common anxiety symptoms. The Hospital Anxiety and Depression Scale. This is a brief screening tool used to identify anxiety and depression symptoms, especially in medical or hospital settings. The Edinburgh Postnatal Depression Scale. This is a screening questionnaire used to identify symptoms of depression during pregnancy and after childbirth. The Kessler K-10. This is a brief psychological distress scale used to assess nonspecific symptoms of anxiety and depression. And the Columbia Suicide Severity Rating Scale, a structured assessment used to evaluate suicidal ideation, behavior, severity, and risk. I'd urge you to do a little homework on each of the assessments I've went over to learn more. Selecting the right standardized mental health assessment depends on the client and the clinical question you're trying to answer. We'll look at how to select the right one next. Choosing the right clinical assessment tool isn't about finding one perfect questionnaire. Instead, think about your client population, your workflow, and your documentation requirements. A community nonprofit might rely on quick screening tools with just a couple of questions, while therapists providing ongoing counseling often administer the PHQ-9 and GAD-7 throughout treatment to measure improvement. Here's some things to consider when selecting the right anxiety and depression assessment. The client's symptoms and how severe they are. The setting. Are you connecting with multiple people per day that may or may not have mental health concerns? Or are you in an ongoing therapy or case management relationship? And available time. Quick screeners for time-sensitive, high-volume intakes with longer tools fitting longer sessions. So let's take a look at a real-world example. Imagine a therapist is working with a client experiencing severe anxiety after losing a job. During intake, the client's GAD-2 score of 16 indicated severe anxiety. 6 weeks later, after counseling sessions and coping skill practice, the assessment showed a meaningful reduction in symptoms, scoring a 10, which is right on the edge of moderate and mild. That measurable improvement helps both the clinician and the client see progress. It supports behavioral health documentation and provides objective evidence that treatment is working. That's the beauty of many of these assessments. They'll have their own scoring mechanisms, making it easy to track the score over time. One challenge many organizations face isn't administering the assessment, it's managing everything afterwards. Client assessment forms, progress notes, treatment plans, secure messaging, documentation, reporting. All of that can quickly become overwhelming for social workers and case managers who don't have a centralized system or are still fumbling around with spreadsheets. Good case management software helps you organize every mental health assessment along with the rest of the client record. Here's some key things to look for when you're choosing a good case management system. You want to make sure it's HIPAA compliant and that it can store assessments securely. You don't want that assessment information spread out across paper files or spreadsheets. Next, you want to make it easy for the clients to fill out their assessments for the ones that are self-report. But you also want to make it easy for your own caseworkers to fill it out with the client that they may be sitting with or on the phone with. So what you want to look for is digital forms with a system that also allows you to send the form to a client with their own client portal. And next, to reduce paperwork and improve reporting, you want to cut down on manual entries and facilitate reporting by ensuring that the case management software you choose generates reports automatically. Some of those, like the Case Management Hub, will generate reports automatically from assessment and intake forms without you having to do a thing. Just send the assessment to the client, they fill it out, and your reporting is already filled in. I hope this video has helped you better understand how to choose the right anxiety assessment tools, depression assessment tools, and behavioral health assessments for your clients. If you're looking for an easier way to manage mental health intake assessments, client documentations, appointments, and more, check out the Case Management Hub. Start a free trial by using the link in the description. No credit card needed. And see how an all-in-one platform can help simplify your entire social work and behavioral health workflow. Thanks so much for hanging with me and watching my video. If you like this type of content and want to learn more about social services and nonprofit tools and resources, like this video and subscribe to our channel. You'll never miss one of our new exciting videos.